which yesterday presented the Guilford Education Alliance with a generous donation of $50,000 to be used to purchase Chromebooks and laptops for GCS students. We are grateful to Bishop Brian Pierce Sr. and the members of Mount Zion Baptist Greensboro for their incredible generosity. Last week, we honored 6 sororities and fraternities who provided a combined $16,300 for the same cause. Our community is truly giving, and we are grateful to them for choosing to support our students in bridging the digital divide and closing the homework gap. Library Media Services, Greensboro Bound Literacy Festival, and Scoopernong Books have collaborated to continue authors engaging students virtually. This month, we are fortunate to bring renowned author Ruta Sepetys. Ruta is a Lithuanian-American writer of historical fiction. She is a #1 New York Times bestseller, international bestseller, and winner of the Carnegie Medal. Ruta will answer questions submitted by our students from 25 schools from across the district. Greensboro Bound will donate 250 of her books to our school libraries, and the recording of the interview will be available for all of our secondary schools and students. I'd like to, at this time, move to a presentation from staff as we get ready to the votes in preparation for our vote, the board's vote on 2 items tonight. I'd also like to acknowledge that we have Dr. Van with us who is our public health director for Guilford County. We also have Don Campbell, who is the director of Emergency Management Services for Guilford County. So we welcome both of them. Dr. Whitney Oakley will begin the presentation this evening.
Good evening. We'll just give it a minute to get pulled up on everyone's screen.
Whitney, while you're getting that ready, I just want to remind everyone that we have American Sign Language interpreters with us, and they are...
This afternoon, we'll be reviewing public health indicators and re-entry options for the board's consideration. As we look at the 2 different indicators, they include public health indicators for consideration and our re-entry option. Since our last meeting and since mid-July, Governor Cooper has announced multiple factors that impact school reopening. As recently as last week, on September 17th, Governor Cooper announced the option for elementary schools to reopen under Plan A as early as October 5th. For tonight's meeting, we will review and vote on public health indicators for reentry and on the suggested reentry option. We have looked at a variety of indicators in collaboration with our public health officials, some of whom are with us this evening. Just as a reminder, we've looked at primary and secondary indicators for school reentry. Just like in education, we look at multiple factors when making decisions, and we will be doing the same with these public health indicators. When we consider primary indicators for school reentry, case incidence includes the number of new cases during a period of time. Positivity rate includes percentage of positive tests to total number of tests. It also considers our ability to implement mitigation strategies, including consistent and correct use of masks, social distancing to the largest extent possible, hand hygiene and respiratory etiquette, cleaning and disinfection, and contact tracing in collaboration with local health. Secondary indicators may include downward trends in hospitalization rates in Guilford County and intensive care unit capacity in the community. At this point, I will turn it over to Julia Van, Public Health Director, for additional health metrics slides.
Thank you, Dr. Oakley, and thank you, Madam Chair, and the rest of the board members for allowing me to be here with you this afternoon to go over some of these indicators a little bit more in depth, and to also give you the opportunity to ask any questions to clarify these metrics even further. The slides that you are looking at right now are the same slides that were presented during the September 8th board meeting, where the risk assessment that is coming out of the Harvard Global Health Institute are listed, where the incidence rate is categorized at 4 different levels. If we move forward in the next slide, you will see that we are adding an additional risk assessment or categorization of the incidence because of the new CDC indicators that came out on September 15th, which was after the presentation that was made to the board. And we want to make sure that we're aligning all of the data and all of the metrics with the indicators that are coming out of the national partners and the researchers and the public health professionals at the CDC. And I will go a little bit more in depth about this particular one in just a little bit. But to start off, just like Dr. Oakley mentioned, we will look at 3 core indicators. And we're starting with incidence. Just like it was mentioned in the previous slide, incidence is the number of new cases in a period of time. You will see that we've included the incidence rates for the last 26 days in the graph at the right side of the slide. So you can see the fluctuation in the new cases that we're seeing in Guilford County, and to also give you an idea of where we are in the last 14 days of incidence. I want to also mention that no one measure needs to be taken separately and independently. We want to make sure that we are making the decisions based on trends and overall information from all of the metrics that we are able to gather from our community. We are also feeling comfortable looking at data trends that have in the past 14 days, going back 7 days. So when you look at the calendar representation of the incidence, Don and I try to make this presentation as visual as possible so you can understand even better how this would look like in a regular situation. You will see that the 14 days starts on the 17th, which is exactly a week from today. So we're going 14 days back from a week ago. And the reason why we're doing this is because we want to make sure that all of our data elements are as accurate as possible. In a regular situation, we wait weeks, sometimes months, for data to be cleaned and scrubbed and analyzed, because we want to give our county leaders in our community the best data that we can to make informed decisions. We are looking at almost real-time data with COVID-19, and we know that sometimes these numbers are not 100% accurate, but we are working really hard to make this data available to our leadership and our community members as well. When we are looking at so we're going to discuss both Harvard model and we're going to discuss the CDC model as well. We're going to take both of them into consideration because both of them have benefits to looking at the numbers. And I would like to just go back to the previous slide just for a little bit to point out the fact that the Harvard model is using incidence just like the CDC does. So that data point is not changing. It is just categorizing the incidence in 4 risk levels. You see the green one, the yellow, the orange, and the red. The green one is talking about less than one case, positive case per 100,000, which in turn for Guilford County translates to less than 5 new cases a day in one day. The yellow one is between 1 and 9 new cases per 100,000, which in turns translates between 6 and 49 in Guilford County with the population that we have. The orange one talks about between 10 and 24 new cases a day per 100,000, which in turn translates to 53 to 134 new cases. And the tipping point, or the red category, is more than 25 cases, new cases in a day, which in Guilford County, which would mean more than 135 new cases in a day. When we're calculating that incidence, and we're using an example here, that incidence is going to fall in one of those 4 risk categories. We want to stay in the yellow category in order for us to be able to make reopening suggestions to the Guilford County School District. And I can go more in depth about this if you have questions further. And I'm going to address the CDC model, and I will stop just to make sure that the board doesn't have any questions about incidence in particular. The CDC model, again, follows the incidence, the new cases of COVID-19 in our community. However, that will be categorized based an entire 14 days period. It will not be we will not look at it every single day. We will look at it for 14 days continuously. And another difference with the CDC model is that it can fall into 5 risk categories compared to what Harvard has mentioned. We have a darker green, a lighter green, and then we have the yellow, the orange, and the red. We have a very similar approach to the way that we calculate the incidence. It's just that it's more of a cumulative incidence over those 14 days. The benefit of utilizing the Harvard model is because it looks at data a little bit more granular, and it gives us a more detailed perspective in that incidence rate. The benefit for the CDC model is that it eliminates the challenge of having maybe one day in which the numbers are a little bit higher, but yet the other days stay pretty leveled. So it doesn't allow for that challenge to make decisions based on maybe 1 or 2 days during that 14 days period if those numbers are not necessarily in the yellow category, for example. So we like to look at both of these models in order to make decisions. We know that we waited to receive guidance from our state leadership, from our national partners, and now we have some information and some metrics that we believe are going to be extremely important. When we have made recommendations to the Guilford County Schools, we have made recommendations based on what we know as public health scientists and epidemiologists, utilizing the data that we have without any guidance from the state or the national partners. When the CDC model came out, we realized that we were on the same track as our national partners. There is going to be a little bit of building on the metrics that we have already recommended with the new CDC ones, but that is only going to strengthen the numbers and the data in order to give us a good idea of where we are as a community, as a county, in order to make those decisions. So I will stop right now to give you an opportunity to ask any questions about this particular metric. And if there aren't any questions, I'll be more than happy to move forward. You just let me know, and I'll be more than happy to do that, Madam Chair.
Great. Thank you, Dr. Van. I'm looking on our participant list. I don't see any hands raised right now or in the chat. Okay, let's see. Well, there we go. Pat Tillman.
You gonna turn her up, or do I need to turn her up? Turn it up.
Yeah, Pat, can you hear me?
Can you hear us? Can you hear me?
I can hear you. I was just wondering if she can hear me.
Yes. Sorry. Yes. Yes. I can.
Yes. Thank you, Dr. Van. In the data, when you look at these numbers that we're looking at, is there any way that you can disaggregate and look at, say, for example, the Harvard model? How many of your sample size are children under the age of 17? Is there a way that we can know that? I think that'd be helpful.
Yes, we can deaggregate the data on age. And I do have a slide at the end of our presentation, and in your packet, you should see one of the graphs that has been included is an incidence graph based on school-aged children. So we are able to include that as well and look at school-age specific numbers as well.
Okay, I mean, I'll wait for the presentation to continue. I don't have a packet in front of me, so I'm just.
Oh, I apologize. It will be in one of the slides that I will go over, and we can definitely discuss it further once we get to that.
Terrific, thank you.
Absolutely.
I don't see any other hands raised, so I believe we can proceed.
Great, I'm ready. So we can move on to the next slide, and we have we'll skip over the Harvard, we discussed this, and we'll skip over the CDC slide, and the next one should be the inclusion of this Harvard model in a suggestion in a strategy for teaching and learning based on those 4 different categories. And you can see the way that they're still stratified in the red, orange, yellow, and green colors. And this is just a suggestion for school reopening and school plans going forward. The reason why I am bringing this to the board is to show the fact that it is a recommendation and it is a best practice for us to look at a staggered and gradual approach to bringing the kids back into the school and identifying all of the benefits and the downfalls at the same time and making that balanced decision. So this is just going along with the Harvard model, and this is their suggested strategy for teaching and learning. Going forward, we will talk about the positivity rate, and I will just give you a little bit of an overview about positivity rate and what are our recommendations with this second core metric. So we're still in the core metrics. This is the second one. For the positivity rate, what is positivity rate? It is a fraction of tests that come back positive. So the way that we're calculating that is that we're dividing the number of positive tests that we're receiving by the total number of tests that have been performed during that time frame. We are using a 1-week time frame right now in order to identify those numbers. And we are moving into a more frequent analysis of those positive tests based on the total number of tests. And you will see the graph in just a little bit. Why it's important to look at it and why are we considering it a core metric? We know that COVID-19 testing has 2 purposes. One, to confirm a diagnosis so that medical treatment can be appropriately rendered if it's necessary. Also, we're doing testing to do surveillance for tracking purposes, for prevention purposes, to make sure that we're suppressing the transmission and the disease in our community. We also want to make sure that we are identifying asymptomatic carriers. So keep that in mind, that testing is not, it's used for 2 reasons. The test positivity rate is useful because we need to know if there are enough tests that are being done in our community And also keep in mind that there are two ways in which we're able to lower that positivity rate, either by decreasing the number of positive tests that come back or by increasing how many tests we're actually performing. We have now two different entities, two national partners that we're and international when it comes to our the World Health Organization recommends that before restrictions can be lifted, the test positivity rate from a comprehensive testing program should be at or below 5% for at least 14 days. With the CDC metrics and indicators that came out almost a week ago, we're also looking at a stratified approach to the positivity rate. It can be from the dark green to the light green to yellow, orange, and red. And because we're talking about staying in the yellow in order for us to be able to move forward, the CDC recommends between 5% and 8% positivity rate. However, we want to be as sure as possible that our community transmission is well underway and it is being handled, and we are looking at positivity rate under 5%. So we're taking extra precautions in that particular area to make sure that we have a good understanding of that. And I would like to just for everybody to understand a little bit more about positivity rate, I would like for you to just think about the test positivity in a way that you can be a little bit visual about it. So think about it about a positivity rate as fishing with a net. So if you catch a fish almost every time you send the net down in the ocean, that means that you have high test positivity. That tells you that there are probably a lot of fish in the sea that you can catch. So that means that there are a lot of cases that you're going to catch. But on the other hand, if you use a huge net, and when you're coming back, you're realizing that there aren't a whole lot of fish in your net, that means that there are not a whole lot of cases left in the community. So try to visualize it in that way in order to understand the importance of a low test positivity and a high test positivity. And that way, it just kind of gives you a little bit of visual there. Moving on. So this is the second core strategy, the second core metric. And I'm going to use the same approach. I'm going to pause and see if there are any questions about positivity rate. This is the data, the chart, I apologize, that shows what we've been calculating for the last 6 months almost. You can see how our tests have considerably increased starting mid-July. That has been the time point where we have created incredibly strong partnerships with a lot of our stakeholders in our community, including our health systems and other incredibly important partners that are helping us with testing. So you can see how our tests increased close to 8,000 tests a week. So these are, every bar represents 1 week. So we are trying to get as close to that 8,000 mark as we can every week in order to make sure that our calculation is as accurate as possible. So you can see the trend in the positivity rate, especially in the last month, that has declined and has stayed pretty steady at 5%. So we are in a good space there, with a dip of even less than 5% about 2 weeks ago. So that is the graph that we will continue to look at in order to identify where this trend is going and where we are with those total of number of tests that are coming back positive. And we're not planning on changing our goal of having at least 8,000 tests done a week in our community. So now, after I went through this graph, I'm going to pause and give the board an opportunity to ask any questions before we move to the third one.
Thank you, Dr. Van. Darlene Garrett has her hand raised.
Please address.
Thank you, Dr. Van. I appreciate your information.
Yes.
So the county health department's recommending 5% or under, or is this CDC or the Harvard model?
It is an overall public health approach of recommendation of the 5%. It is the recommendation of the North Carolina DHHS department, as well as the World Health Organization and the CDC. So it is a collaborative approach and a public health approach in this particular recommendation.
Okay. Now, we're hearing from a lot of our teachers that have concerns. They have underlying conditions or their families do. And they are asking us to have a metric of 3% or lower. Can you tell us what that would mean? Or I know you can't probably tell us how long it might take us to get there, because it really depends on if people follow rules like they should. But do you think that's a reasonable request?
So let me address the time frame first. Of course, we do not know exactly how long it will take for each one of these percentages to drop from 5 to 4, from 4 to 3. All I can say is that in the graph that we have pulled up right now, in mid-July, we were at about 8% positivity rate. So it took about 10 weeks in order for us to get to the 5%. So those 3 percentages took us this time, and a lot of effort from a lot of community partners. So it is a lot of work to get to that, and it's a lot of work to stay there. And we need to add even more work in order to drop it even lower. It is our plan to move those metrics down as much as possible. So going towards the 1%, that is going to be even better. So we're not saying that we're satisfied with 5%, but we know that once we start seeing that drop under 5%, we are moving in the right direction. Also, I want to mention the fact that as much as the school system has been working with us and have been working internally to create these mitigation strategies and plans, as much as the health department and our partners are working tirelessly to address these things, it is also our community that needs to tirelessly work in order for our numbers to go down. So I can't stress it enough that this is truly a community effort to get these numbers down. So the reason why I believe that the 3% is coming in the conversation is because out of the CDC metrics, the darker green, which is the best category in which we need to be in, mentions less than 3%. So that is correct. That is a recommendation from the CDC. However, in our community right now, we are not in that green category. So we need to look at what is our next step. We're taking step-by-step approach. So right now, we need to be under 5% in order to be into that yellow category. And I hope that that answers the question.
It does. And so obviously, if we were to set a metric of 3%, that would be considerably safer for our teachers and our students, correct?
All of the metrics that are going lower and lower are safer and pose less risk. So if we're looking at the whole picture as a risk, it is about the risk assessment of how we're introducing, when we're introducing, and how likely are we to introduce the virus in the school system. So thinking about it that way is also helpful to understand a little bit that metric.
Okay.
Or the categorization.
And when you speak about the hard work that your people are doing and that all of us are doing, can you be specific about what kinds of work that are being done and what we need to do to help make sure that our numbers continue to go down?
Absolutely. So I can start by saying, because we are talking about this particular metric, testing. So making sure that we have as many tests available to our community as possible. So that has been an effort, a continuous effort with Cone Health, with Wake Baptist Forest, with Old North State Medical Society, with our local FQHC TAPM, with CVS, with Harris Teeter, and I can keep going on and on with different partners. So making sure that we have the supplies, first of all, to even administer the tests, making sure that we have the staff to perform the test at all of the events and testing opportunities that we have. Also, being able to capture data where we're putting out these metrics has been also a huge effort, since we are talking about almost real-time data. So testing as a whole has been and continues to be a big effort. And the message that we're trying to put out to our community is that continue to seek testing opportunities. If you have symptoms, if you have been exposed, if you are in a high-risk category. The second effort has been case investigation and contact tracing, making sure that we're reaching every positive case that we're aware of and finding out those possible close contacts. That is one of the most important strategies that we have, tools that we have as public health professionals to respond to the pandemic. Some of the challenges have been not reaching the positive cases, not being able to get in contact with them for various reasons. So, or for them to share with us who their true contacts are. So in this particular situation, our message to our community is reach out to us and find information, ask us questions. We'll be more than happy to clarify anything for you. If anybody's calling you from a 336-641 number, it's the health department. Please answer the phone. We really need to talk to you. It might be very important to you and your family. Moving along into some of the other challenges, talking about understanding the guidance and understanding the recommendations and staying up to date with all of the new recommendations that are coming out. So reading all of the articles and reading all of the research that is being done, it's also part of our work that we need to do. So our message to our community in that particular situation is be patient with us. We're trying to stay up to date with everything so we can give you the best information that you need, that is vetted and that is put out there by trusted partners. So those are just three to give you a little bit of an idea and how they all relate to our community and what can be done together in partnership.
Okay, and what are the things that you think that we as citizens need to be doing to help lower our positivity rate?
Well, we need to make sure that you continue to do all of the mitigation strategies that we are very much promoting. Wear the face covering, stay 6 feet apart and practice social distancing, wash your hands and practice good hand hygiene, and stay home if you're sick or if you have been in contact with somebody that's COVID-19 positive, because it will lower the positivity rate from the end in which we have less positive cases that are being identified.
So if we go back to school, it would most likely be very important for every student to have a mask. Is that correct?
That is our recommendation.
Okay, thank you. Appreciate you very much.
Absolutely.
Thank you, Darlene. We have Kim, Anita, Pat, and then Byron. Kim?
Thank you. I just wanted clarity in regard to the 8,000 tests and whether or not is people that have already been tested, are they in that number if they have to get tested again? Can you just clarify what you meant by that, weekly testing?
Yes, absolutely. So the number of tests are calculated based on the electronic tests that are reported to us. So a few months ago, the state health director has made it mandatory for all test results to be reported to us, positive and negative. So that gives us an idea of how many tests are being performed in our community. The way that this is calculated is per total tests that are done in that 1 week time frame. But the number of positive cases, it is only for that one time. So nobody is calculated, it's included in the metric twice. And the reason why it's 8,000 or close to 8,000 is because we want to test close to 6% of our Guilford County population within a month period of time. So if you're thinking about 8,000 a week in a month, it's approximately 6% of our population.
Thank you.
Thank you, Kim. Anita?
I'd like your opinion on Governor Cooper's recommendation that students return to school. What effect do you think that's going to have on the positive test rate? And do you agree with that recommendation?
So I believe that, first of all, Governor Cooper's announcement that came out last week was not a recommendation, was an option. Second of all, he very specifically mentioned that it depends on where that community is at this time, and that we need to look at our, in a way, like our jurisdiction to be able to make those decisions. So it might be very different across the state in the way that those numbers look like and where every district is in this process. So
seen the numbers?
Private schools
Been strong.